Jitu, hello. Jitu.
Hello, Kekau.
Hello, Kekau. Hello.
Hello.
Yeah, Usha madam.
Hello, good morning.
Good morning. Kekau lale.
Kekau.
Madam, good morning. Jitu.
Hello. Kekau lale.
Kekau. Pinne, ippade. ജോസാറിന്റെ സ്ലൈഡ് അങ്ങോട്ട് വാട്സപ്പ് ചെയ്തിട്ടുണ്ട്. അത് മെയിലിൽ ഒന്ന് തുറന്ന് എടുത്തോണം, എന്നിട്ട് ഞങ്ങൾക്ക് ഒന്ന് സെൻഡ് ചെയ്യണേ. മെയിലോട്ട് അയച്ചിട്ടുണ്ട്. ഉണ്ടല്ലേ.
രാജേഷിന്റെ സ്ലൈഡ്സ് ഒന്നും ഓൾറെഡി ഇട്ടിട്ടില്ലേ?
Hello, madam. Good morning. Madam, good morning. Hello. Hello, Elsa madam. Hello. Hello, madam.
Hello, Usha. Good morning.
Good morning, madam.
How are you?
Fine.
Yeah.
saying that. They accepted the homeless one. So they should have put their surgery's address on his.
Did you go to the local pharmacy to try and get your prescription?
I went to doctors.
Yeah, Ventolin. You got Ventolin. And why didn't the doctor prescribe it again then? Because they're saying what? It's not on your repeat prescription. I'll show you. It's on the East London record, but it's on your channel. Is that only for all people that are registered all boroughs?
I know, but is that if the surgery allows it, or is that just that?
Well, most boroughs have permission it because they're XLB initiative. So if you go on, so let's say I want.
ഹലോ അല്ല ഇതിനകത്തൊന്നും കേൾക്കത്തില്ല. ആരെങ്കിലും പറഞ്ഞാലല്ലേ കേൾക്കത്തുള്ളൂ. ഹലോ കേക്കാമോ?
Yes, hello.
ഓക്കെ ശരി മാഡം, ചെക്ക് ചെയ്താ മാഡം. മണി മാഡം.
Good morning.
Hello, 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 Jitu. Hello, hello, Jitu. Jitu. Praful. Hello, Praful.
ഹലോ
കേക്കാവോ? നമ്മുടെ ബ്രോഷർ ഒന്ന് ഇടാവോ, ഇട്ടേക്കാവോ? പാനലിസ്റ്റ് രാജേഷ് ജോയിൻ ചെയ്തു. ഹലോ രാജേഷ്, ഗുഡ് മോർണിംഗ്.
Morning, madam. Morning.
Okay, thank you so much.
Hi Rajesh, how
Hi.
are you?
I'm very good.
Okay, nice to see you.
Nice to see you.
Hi Anna.
Hi, ma'am. How are you?
Fine, how are you?
Good. Thank you.
Okay, fine.
Hi, Sulekha.
Hi.
Hi, Sulekha.
Hi. Good morning. Thank you for
Good
joining
morning.
this time.
Actually, good night for me, but still.
Yeah. Right. Okay.
It's 12 midnight here.
Okay. Oh, after attending inauguration session, you can leave. Okay. Thank you. Whether Lena will join? Lena?
I don't think so. I don't know. I did ഇന്ന് സംസാരിച്ചപ്പോ ഒന്നും പറഞ്ഞില്ല.
പറഞ്ഞില്ല. Okay. ശരി. Okay, thank you. Okay.
കേണ്ടി ആദ്യത്തെ സെഷൻ എടുക്കുന്ന ആരാ? അതല്ല ജോ. ഓക്കെ. ഡോക്ടർ ഹെന്ന. ഓക്കെ. ഇന്നലെ തന്ന അതേ ഓർഡർ തന്നെയല്ലേ, മാറ്റമൊന്നും കിട്ടും? ഓക്കെ. സ്റ്റാർട്ട് ചെയ്യാം. അങ്ങനെയാണ്. ഞാനിന്നാ സ്ക്രീൻ ഷെയർ സ്റ്റോപ്പ് ചെയ്യണ്ടേ? സ്റ്റോപ്പ് ചെയ്യണമെന്നുണ്ടോ അതോ മറ്റേ കോളേജിൻ്റെ മാത്രമേ?
Shall we start the program?
Yes.
Good morning, good afternoon, and good evening, everyone. COVID-19 pandemic declared by WHO in March 2020 has globally affected 216 countries with 1,78,89,134 confirmed cases and 6,86,145 deaths as on August 3rd, 2020. According to Ministry of Health and Family Welfare, there are 5,79,537 active cases and 38,135 deaths in India. Till now, the total confirmed cases in Kerala is 25,911 with 11,342 active cases and 82 deaths. This pandemic is continuing to perpetuate an intense and catastrophic impact upon people in India and across the world. The radical changes and ensuing stress brought about by the COVID-19 and the lockdown has resulted in different sort of difficulties in people. It is important to highlight the fact that certain people are encountering an additional crisis of understanding and dealing with present challenges brought about by the pandemic. Children with disabilities comprise one such group that is undergoing a hard time. So in the current scenario, managing the stress of lockdown and taking care of children with disabilities demands high priority. Mounting concerns regarding strain on healthcare systems are already occurring and likely to get significantly worse. This health crisis impacts not only frontline staff and clinical leaders, but all systems and communities. It has already disrupted universities and academic institutions. The move to providing education in an online format has highlighted several issues in nursing education also. Keeping this in view, Government College of Nursing has organized an international webinar series to attend the challenges of COVID-19 on nursing education and disability management. We will begin the program with a short inaugural function.
Okay, good morning to all. So though we are conducting the meeting in a remote platform, so we will have a short inaugural function. Okay, so for the welcome speech, Dr. Usha VK is the principal of Government College of Nursing, Kottayam. And she had her BSc Nursing degree from Government College of Nursing, Trivandrum, and post-graduation from NIMHANS, Bangalore, and her specialty is psychiatric nursing. And she had acquired PhD from the consortium of INC and RUGHS Bangalore in 2013. And she had a wide experience in the field of nursing and has prominent positions in various organizations. And she is a Senate member and PG board member of Kerala University of Health Sciences. And she is an editorial member for Kerala Nursing Forum. And she is an ex-vice president of Indian Society of Psychiatric Nursing. And recently, last year, she has awarded Best Teacher Award by the Kerala University of Health Sciences. With immense pleasure, I invite Dr. Usha VK to deliver the welcome speech. Madam, over to you.
A warm good morning and good evening to one and all. I'm very happy and delighted to welcome all of you to the international webinar series on challenges of COVID-19 on nursing education and disability management. This webinar is organized by Government College of Nursing, Kottayam in collaboration with the Inter-University Center for Disability Studies, MG University, Kottayam. Our institution, Government College of Nursing, Kottayam, started in the year 1982 and produced numerous professional nurses who are serving in different capacities across the globe. And I feel proud to be the part of this great institution. IUCDS is a center under MG University, Kottayam.
Yeah. Come in. What's it under TVA?
Am I audible to?
Yes, ma'am.
IUCDS is a center under MG University, Kottayam, addressing the physical, psychological, and socio-cultural issues related to disability and evolving sustainable solutions. We are extremely happy to collaborate with the webinar with the IUCDS MG Kottayam.
That was yesterday's mine. And we've got.
We all know that people in all sectors across the globe have been affected by the pandemic COVID-19. Aim of this webinar is to orient and capacitate nursing professionals and special educators to battle the challenges during COVID-19. Now, let me enter into my duties. We are lucky to have Dr. Valsama Joseph, our former principal, to inaugurate the webinar and deliver the keynote address. When I approached Madam, wholeheartedly she has given her consent. Madam, I extend a hearty welcome to the international webinar. We have this webinar series for 2 days, that is on 4th and 6th August 2020. We have expert panelists for these 2 days from in and out of the country. Dr. P.T. Babaraj, Honorary Director, IUCDS, MG University, Kottayam, and also Sir is one of our coordinators of this webinar. Sir, I extend a hearty welcome to you. Next, I would like to welcome our expert panelists to this international webinar series. Mr. Joe John George, Kerala Disaster Management Authority, Thiruvananthapuram. Dr. Henna N.N., Lecturer, IUCDS, MG University, Kottayam, and Mr. Rajesh Divagaran, Senior Risk Management Advisor, United Nations High Commissioner for Refugees, Bangladesh. And Mr. Rajesh is our beloved alumni member too. My hearty welcome to all of you. Ma'am, I extend a hearty welcome to Ms. Adriana Horn, Director of Transformation and Setting up New Services, UK, who has consented to lead the session on COVID-19 home monitoring services. Ma'am, I hearty welcome from God's own country, Kerala. I also extend a warm welcome to Mrs. Selina Staria, Advanced Nurse Practitioner at Northeast London Foundation Trust and Royal London Hospital Urgent Treatment Center, who is sharing her experience and expertise on clinical streaming in emergency department. My hearty welcome to our international webinar series. I'm extremely delighted to welcome our dearest alumni members, Dr. Anna George, Assistant Professor, Molloy College, USA, Mrs. Leena Alapat, Nurse Practitioner, USA, and Dr. Girija KM, Faculty, Sultan Qaboos University, Sultanate of Oman, who all have expressed their willingness to be the part of this webinar. Next, my hearty welcome to all the delegates, teachers, research scholars, my colleagues, students to this international webinar series. Warm welcome to the coordinators of this webinar, Mrs. Sulekha Yeti, Associate Professor, and Mrs. Rakhi Manyuran, Assistant Professor, Government College of Nursing, Kottayam, who spent day and night to organize this international webinar to make it a grand success. Hearty welcome to both of you. Once again, my hearty welcome to one and all. Thanking you.
Madam. Now we have another eminent, enthusiastic teacher, leader, as well as perpetual learner, Dr. Valsima Joseph, for inauguration and keynote address. She is the former principal of Government College of Nursing, Kottayam. She has a BSc from Government College of Nursing, Trivandrum, MSc from SNDT University, Mumbai, MPhil from Manipal Academy of Higher Education, Manipal, and PhD from MG University, Kottayam. She has education and research since 1987. Madam has a vast research experience and has published regularly in nursing journals. She is the author of the 2 books in the subject Nursing Foundations, and considering her contributions, she was awarded with Venus Excellence Award in Nursing in the year 2018. May I invite Dr. Valsima Joseph for the inauguration and keynote address. Over to you, ma'am.
Thank you. Good morning and good evening to one and all. I am very happy to know that Government College of Nursing Kottayam has organized an international free webinar series in collaboration with IUCDS of Mahatma Gandhi University Kottayam on challenges of COVID-19 on nursing education and disability management. In this occasion, I special appreciation and congratulations to Dr. Usha VK Principal, Mrs. Sulekha Yeti Associate Professor, Mrs. Rakhi Manyuran, and other faculties of Government College of Nursing Kottayam and IUCDS of Mahatma Gandhi University, and all the national and international expert panelists of today's webinar, Dr. Babu Raj, Honorary Director IUCDS, Mr. Joe John George, KSDMA, Thiruvananthapuram, Dr. Hema, Lecturer IUCDS, Mr. Rajesh Divagaran, United Nations Senior Risk Management Advisor, and he is also an alumnus of Government College of Nursing Kottayam, and dear participants. WHO has declared the year 2020 as the International Year of Nurse and Midwife. And globally, nurses are in the front line to fight against COVID-19 pandemic. We are passing through a very tough and unpredictable phase in our life. COVID-19 has changed substantially the way we live and has already disrupted universities and academic institutions, including nursing schools and colleges. At present, there is no classroom teaching. Theory and practical examinations are also postponed due to this pandemic. To live with the COVID-19 era, we have to make many alternatives to substitute the old style of functioning and for the delivery of knowledge. We are experiencing a global learning crisis. Due to the closure of nursing schools and colleges, routine education is disturbed, and quickly shifted teaching to online mode using various platforms like Google Meet, Google Classroom, Zoom, WebEx, Indian app like Say Namaste, etc. which ignored India's immense digital divide due to the non-availability of high-speed internet in rural and remote areas for smooth flow of classes. The educational system cannot function, keeping the underprivileged out of this online mode. A section of the society still cannot afford to buy good quality smartphones or laptop, which is a necessity for the online education system. Online education will be successful only if it reaches every nursing student. Another challenge is that many teachers are ill-equipped for online teaching. To make the digital education effective, the teachers must be equipped with good delivery models. The problem in this era is that students are far ahead in understanding digital environment than sizable number of teachers. Nurse educators as a whole is acquiring skills, but there is a minority who still hesitate to venture into these digital platforms. Nurse educators are bracing for unique challenges related to their role in helping students into the development of next generation care providers. We question how we will continue to educate nursing students in a society facing social distancing, isolation, and quarantine measures, while also needing nurses at the front line. The move to online education has required faculty make changes in examination procedures and grading systems. Students in the nursing education program must complete clinical placements to fulfill the nursing requirements. When students are in the clinicals, there are concerns regarding the possibility of transmission. Students may be an asymptomatic carrier of COVID-19 and cause an unconscious spread of infection. If students are in the clinical setting, they risk not only their health, but also of their family. The challenge to provide relevant clinical experience has resulted in an increased use of high fidelity mannequins in simulation lab, telehealth, and virtual reality. It is realized that 50% of clinical practice can be substituted with a high fidelity mannequins. Nursing students also have their concerns about not reaching the career goals. Nurse educators may also feel a heightened and acute sense of guilt for not contributing as frontline health worker during the pandemic. I had the same feeling 2 months back while I was the principal of Government College of Nursing, Kottayam. COVID-19 pandemic also created challenges among students with a disability. 80% of persons with disabilities live in developing countries where access to education is an ongoing challenge. COVID-19 has given an opportunity to all the parents or children with special needs to become a great mentor to their children and assist them in their learning through multiple mediums such as digital or through worksheets. It is a question in many minds that shall we teach special children online or not, and how? It is becoming difficult for children with special needs because their memory and retention power is not similar to others. The best pedagogy for children with a disability to retain and continue learning is offering teaching through educational games and self-engaged activities. There is a wonderful saying that teach me the way I learn, not learn the way I teach. And this is the time to execute this same. I hope this international pre-webinar series will provide an in-depth knowledge to the participants regarding the challenges of COVID-19 on nursing education and disability management. All panelists of today's and day after tomorrow's webinar are experts in the concerned field. In this occasion, I am glad to declare that the international webinar series is formally inaugurated. Also, I express my gratitude to the organizers with a special mention to Dr. Usha B.K., Principal Government College of Nursing, Kottayam, for giving me this opportunity. I wish best wishes and on all the success for this event. Thanking you all. Thank you once again. Bye.
Thank you, Madam, for the keynote address. Before we start our sessions, let me remind you that if you have any queries, post in the chat box. If you want to interact directly with the speaker, click on the raise hand button on your device, and that will be addressed at the end of each session. Do not forget to fill the feedback form, for which the link will be given at the end of the session. Now we will move on to the sessions.
Okay, we will have next session by Mr. John George, who is presently working as the State Project Officer, Kerala State Disaster Management Authority, Government of Kerala. And he had his master's in social work, University of Pune, India, and postgraduate diploma in disaster management. And he has about 12 years of experience in the field of disaster risk reduction. And he is an expert in the community-based disability reduction and inclusive DRR and school safety extra. And he took many projects in the country and over other foreign countries. So one of the project was KSDMA Flood Recovery Program, State Project Officer during 2018 and December 2019. And another project he participated is Disaster Risk Reduction and Climate Change Adaptation as a State Project Officer during 2014 to 2017. And he also worked in World Vision India as a Program Officer during 2009 to 2014. And he has also been a Project Officer in Holistic Child Development India during 2007 to 2009. And he is also a project coordinator as ISA from 2004 to 2005. Now I invite Mr. Joe John to proceed with the session. So, I think it's some little connection problem with the Joe John, so we will little wait for. Okay.
Sir, you can start the session, sir.
Are you okay, sir?
Yes, can you hear me?
Yeah.
Thank you and good morning to everyone. I would like to appreciate the initiative by the Government College of Nursing and IUCDS for organizing such an event on this issue of COVID inclusion. Just 1 second, hope you can see the slide also.
We cannot see the slides. Now we can see the slides.
Okay, thank you. You would be operating, or I should be doing it? I think you have done it from there. So can you progress the slide?
Sir, it's better if you operate it. If you cannot do that, we will do it, sir.
Okay, then I have to share my screen.
Okay, sir.
I'll do. For that, you have to make me the host.
We'll do that, sir.
So welcome to the session. Those who have logged in from different parts of Kerala and India and also abroad. I understand it's an international webinar. So I welcome each of you. I am Joe George. I will be presenting on the disability inclusive COVID response, as I was asked to. Dr. Babaraj and Hannah and others also would be speaking on the session. So I'm moving forward. I've been given 20 minutes. I should be stopping by 10:20. So I will go ahead without wasting much time. This news article, which came few days back on Times of India, carried the news of a person who is a person with disability, who had to be. 3 participants have raised hands. Is it because they cannot see or hear? I'm not very sure. So please, the admin can check from the college side. Okay. So this man had difficulty in going home since it was locked down after COVID. So the news article, the journalist is describing how difficult it was for the person with disability. Before I get into much of COVID response, I just wanted to share our experiences in the state of Kerala, especially the initiatives done by Kerala State Disaster Management Authority. When we started consulting with persons with disabilities, some of them were saying even the terminologies that people have used to address persons with disabilities also was strange. In the initial days, I mean, long back, many years back, when a person had to book as a passenger in a train, the terminology used for a person with disability was invalid. So I'm sure you would understand the meaning of that term, invalid. Then we changed it to handicapped, persons who are handicapped. Then many terminologies were used. Some terminologies which I remember are invalid, handicapped, then differently abled, then persons with disabilities, then the latest being the Honorable Prime Minister of our country named them as Divyangan. But the persons with disabilities, wherever they are, they raise a concern that irrespective of the names being given to us, the stigma, the marginalization remains the same without much of a difference, which is to a great extent is true. When we look at the numbers around the world, we see that around 15% of the total population of the entire world are persons with disabilities, according to World Disability Report 2011. Then in India, we see that 2.1% people are persons with disabilities. And when we come to the state of Kerala, according to the 2015 census done by the Social Justice Department through Kerala Social Security Mission, we see that around 2.23%, that is almost 800,000 people are persons with disabilities in varying degrees. Around 22 types of disabilities are mentioned there. Accordingly, they have done a census, and they have come to a number of 793,937. Now, when you look into the safety and security of persons with disabilities, in general, they need additional care and protection. So naturally, when there is a disaster or an emergency, they are required for additional assistance. You all will agree to that. So hence, from 2015, Kerala State Disaster Management Authority decided to support them and also give sufficient care and protection for persons with disabilities during any disaster and emergency. And hence we started a project in 2016. And as you can see on the slide, we have done various activities and interventions in the state. When I say this, in India, Kerala was the first state as a government initiative to start this project. We had nothing then, I mean, the guideline or materials on training persons with disabilities on emergency care and protection. And I understand that many of you are nurses and paramedics, health professionals. So definitely we all should have a perspective, humanitarian perspective, as how we can cater to the less privileged population. How can we extend our help to persons with disabilities? Then, you know, in the general operations, how do we cater to them? Then we came out with a handbook on disability and disaster risk reduction, which is available online. The same print version is also available on Braille. This also is available with our office. Whoever is interested can write to us, and we will share a copy of even the digital copy is already available on the website, but the Braille version, if it's needed, we can share it with you. And as you are aware, when we work with persons with disabilities, one of the major needs or one of the major challenges is to provide differently abled friendly materials, or you know, the materials which we produce. Now we are doing this seminar or webinar online. Now, if a person with hearing impairment is participating this webinar, that person cannot comprehend what we are saying because he or she cannot hear. So how inclusive are we? If you look at international media, whenever there is a press briefing or any major seminar or a conference, definitely they will include a sign language interpreter, so that even if one person out of the 120 people participating here, that person should understand what is being spoken. So that is how we include persons with disabilities. So when we include them, there needs to be much more facilities, people who are, you know, skilled to do all such initiatives. So these are some of the materials that we have produced on various hazards. We also have a sign language video, which is also available on YouTube. You can search. It is an all-inclusive video. When you run this video, this is on 5 different hazards of Kerala. When you run this video, person with disability like visual impaired person can hear, a hearing impaired person can see the sign language, physical or locomotor disability can understand and read what is being texted there. So this is an all-inclusive video. So such initiatives should be promoted when we talk about disabilities. So these are some of the technological advancements that we have done. DAISY format is already there. It's an open source format. I mean the software. So we have converted 5 different hazards. I mean the details, advisories, and the directions on do's and don'ts on 5 different hazards like lightning, earthquake, floods, drought, and fire onto DAISY format. This is a typical training session that we conducted across the state in all the 14 districts, 4 days each. In every district program was there. It started in Kottayam itself, your own district. Inter-University Center for Disability Studies, led by Dr. Baburaj and Dr. Hena and others, took the initiative to conduct trainings across the state in every district. They went with their team and trained with the persons with disabilities, and I'm happy that they are also part of this organizing team. So these are some of the videos which are available online. What we found was during 2019 floods, this particular video, the video on flood, you can see that the video on flood got maximum views. So it showed that people are in need of relevant information in sign language when there is an emergency. People would like to know more, especially persons with disabilities, because generally people do not speak to them. If a person with hearing impaired is at home, generally, since you need sign language, since it is difficult to speak to them, generally you tend to ignore such people. That is why we say time and again that persons with disabilities are inversely proportional or disproportionately affected in emergencies. Our website itself is persons with disability friendly. This website is available. You can see the icon on the left, and also we are also giving audio early warning messages. The National Disaster Management Authority came forward with the guideline much later than we started. It was launched, the draft was launched in 2018, but the final version came just a few months back in 2019. This is few of the glimpses in Ernakulam when persons with disabilities and elderly were specially rescued and evacuated from the flood prone areas in Ernakulam. Especially this was done by Tunnel, an NGO who was also in partnership with us to conduct various programs. Now I come to, this was a brief background on where we stand in the state on disability inclusion. Now I come to the topic, that is disability inclusive COVID response. So having this background with us, we immediately started thinking how the COVID response can be made disability friendly. As some of you may be aware, Kerala was the first state to declare COVID as a state specific disaster. It was declared on February 4th of this year. As you also know that the first 3 cases in India was in Kerala, the COVID cases, people who came back from Wuhan. So Kerala was susceptible, or Kerala was vulnerable to this virus, and this was studied in our department, and the state's executive committee with their powers conferred by Disaster Management Act 2005 declared this pandemic as a state-specific disaster. Followed to which on 10th February, just I'm emphasizing the date, 10th February, as early as that. 10th February, KSDMA, with the support of National Institute of Speech and Hearing, produced a sign language awareness video, which was made available on YouTube and other social media, where, as you can see on your right, the person with disability explained the advisories or the actions to be taken during Corona. So this was made friendly to persons with disabilities. When we look into the Government of India initiative, we see that in 27th March, the Government of India, the ministry came forward with the guideline, which was shared with the chief secretaries of every state. It came to Kerala also, and the commissioner of disability commissionerate shared and disseminated the information to all the districts. Another initiative we took was to have a 24/7 helpline number for the deaf community. This was again was jointly organized by KSDMA and NISH. It was started on 31st of March 2020, and it went up to 19th June. As you are aware, we had lockdown, and many of them had difficulties during the lockdown. So the need was to have a helpline to give timely support to the persons with disability, especially deaf community. So we received around 400 calls on this helpline. The helpline had experts from health, experts from mental health, experts from disaster management, experts from niche, those who could really sign the communication, or they were ready to interpret to the persons who are deaf. This service will also be continued in the monsoon season, which is already there. Now we have a full-fledged helpline number 24/7. So many of the calls came in, as you can see on your right. This is the screen. This is a WhatsApp media call, group call, which will be there. So the person with disabilities, the interpreter, and the expert will be attending the call. So many of the calls came in, especially requesting for batteries. As you are aware, due to the lockdown, batteries were not available. Many of them are using assistive devices like hearing aid. So when you use a hearing aid, it is quite natural that after a few weeks or months, the battery will drain. So you have to replenish the battery. So how do we do it when the shops are closed, or when the hearing aid device is not functional, need some repairs? How do we do that when the lockdown is in place? So we intervened in this situation, and we procured batteries from different places. We did a logistics arrangement, supply chain arrangement, and the batteries were distributed to persons who are in need. So these calls, majority of the calls, almost 80% of calls were in requirement of batteries. So we supplied these are some of the snaps where we used the fire department and the volunteers with us to deliver the batteries to their doorsteps free of cost. The delivery charge, we didn't charge any delivery cost, but the batteries, those who could afford, did pay for the batteries. So that was another initiative that we did. Some of them also wanted food, since it was lockdown and they couldn't really go out and buy things. The volunteers served food for them. Another initiative was that when the lockdown was in place, the government employees or the teachers in the blind schools had a concern that they are not able to travel, especially in public transport, as they are dependent on others to for mobility. If they have to cross a road, or they have to alight from the bus or climb the bus, it is difficult for them, because we are suggesting that a physical distance should be maintained, you know. So how do they, they practice that? So they have to depend on someone else. So a representation or a complaint came to KSDMA, and this was brought to the notice of the Honorable Chief Minister. And the order was made that, as you can see on the screen, the lockdown relaxation was given to visually impaired and the people who are having, such type of disabilities, or even those employees' children who are impaired or intellectually challenged, like cerebral palsy, autistic children, were allowed to remain without reporting to the office. So this was another initiative. And as you know, every day Honorable Chief Minister meets the press, and we do not have a sign language interpreter there. So this was taken note by Nish, and Nish paraphrases it and prepares an sign language video, and the important matters shared by the Chief Minister was converted into sign language and made available, so that persons with disabilities, especially the speech and hearing impaired people, can look into this and get an update of what is happening around on the face of COVID. Looking ahead, we are also looking into, when we talk about inclusion, and also when we talk about sustaining them and keeping them safe and secure and protecting them, persons with disabilities, in the days to come, we also have to look into the continuity of labor. Many of them are lottery sellers. Many of them are running petty shops. So how do we ensure the continuity of labor and their access to employment? How do we train the caregivers and parents to ensure that the persons with disabilities continue to be safe, and like hand washing, wearing mask and sanitizing, physical distance, all these things? How do we do? If at home also, if a person has to, if a bedridden person has to go to the washroom, or someone has to push the wheelchair, so the person pushing the wheelchair may have to clean their hands first, wear masks. So all such life skills should be taught to the caregivers also, not only for the persons with disabilities. And also to get the information, correct information, access and affordability to healthcare. Where do they go if they have symptom of COVID, or sneezing or fever or whatever? So where do they go? How do they go? Whom do they meet? All such things, like government has come forward with the e-Sanjeevani telemedicine helpline, or that facility is there. So how do we use, and how do we train the person with disability to access that information? And also, as you are aware now, schools are not there, education institutions are shut. Now, how do we help them to understand? Because we also received some concerns from parents saying that the digital media or the WebEx platforms are not very comfortable for persons with disabilities to learn, especially the children who need special care and assistance, learning disabilities, have children who are having learning disabilities. How do we specially coach, additional assistance to be given, so that they cope with the change? We also need disaggregated data, which is needed to have the special interventions. For example, we may know that, okay, there are around 10,000 people who are active COVID cases. Now, out of the 10,000, how many are persons with disabilities? How many are in which age? How many are women, men? So all this data should be made available, so that nursing colleges or NGOs and institutions like IUCDS can extend help according to the need. And lastly, we also need relevant studies to assess the impact of COVID on persons with disabilities, so that interventions are made to address such gaps. So with this, I stop my presentation. So on all these efforts, let us not leave anyone behind on the COVID response. That is from my side. Thank you for this opportunity, Nursing College and IUCDS.
Thank you, so, sir, for the very informative session on disability inclusive COVID response and making us insightful about the additional crisis faced by persons with disabilities during disasters, including this COVID season, and how inclusive are we, and the various programs extended to help persons with disabilities. So thank you for devoting your precious time with us. Now it's time for discussion. If anybody has got any queries, you can ask. We have not seen any questions in the chat box till now. If you have any questions, you can ask directly. We will unmute them. Otherwise, we'll move on to the next session. So hope there are no questions. Everybody has understood. So we'll move on to the next session. Thank you, sir.
Thank you. So I will be online for the house.
Sir, can you be online? Because at the end, there will be some
Yes.
discussion and all.
Thank you.
So we'll move on to the next session. So next we have Dr. Hena Enen to talk about the prevalence of depression and suicide among persons with COVID-19. Dr. Hena Enen, lecturer in disability studies, IUCDS MG University Kottayam, has 13 years of experience in teaching, training and research. She is a dedicated teacher, psychologist and a renowned behavioral trainer for various companies, government and non-governmental institutions. Her areas of interest are disability studies, geriatrics, inclusive disaster risk reduction, stress and adjustment. Coming to the educational profile, she is the university first rank holder in MSc Health and Behavioral Sciences from MG University, Kerala, MPhil and PhD in Psychology from Sri Shankaracharya University of Sanskrit, Kaladi. She also possesses certificate in geriatric care from Southern Cross Care, Australia, and has to her credit a certificate in human resources development in counseling skills from Trada Institute of Social Sciences, Kottayam. She is the co-author of the famous book, Managing Soft Skills for Personality Development, internationally published by Tata McGraw-Hill. Currently, she serves as consultant psychologist, Peace Valley Human Care Foundation, Kodamangalam, Institutional Ethics Committee members and life member, Alzheimer's and Related Disorders Society of India, Quality Assurance, ASAP, Government of Kerala, Resource Team member, KSACS, Government of Kerala, Member Advisory Committee for Revision of District Disaster Management Plan and State Policies, Government of Kerala, and a resource person for Kerala Institute of Local Administration, Government of Kerala. So, Madam will be speaking on prevalence of depression and suicide among persons with COVID-19. Over to you, ma'am.
Thank you very much for that wonderful introduction. Very good morning to one and all. Thank you very much for this wonderful opportunity to be a part of this program. I hope I'm audible to all of you.
Yes, ma'am.
Okay, thank you very much. So shall I share my screen now?
Yes, ma'am.
Okay, okay, thank you. Okay. So Today, I'm going to deal with the topic prevalence of depression and suicide among persons who are affected with COVID-19. So let's start with the quote by the famous psychologist Carl Jung. The shoe that fits one person pinches another. There is no recipe for living that suits all cases. So when we need to start with this saying, just because we are facing a very different problem these days due to this COVID-19 pandemic affected across the world. It's very new situation for all of us. The world itself facing such a very difficult situation for the first time. So I'm moving to my topic. It is prevalence of depression and suicide during COVID-19. Before starting the session, let me talk about what World Health Organization talked about. 1 minute, let me just, okay. But as we all know, World Health Organization stated that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Nowadays, during this COVID-19, we need to think of all these aspects. But what we are seeing is it is a life-threatening condition for almost all the, even for the whole generation of human being. So we are mainly focused on the physical health only. But when we state that, World Health Organization says that a health means it is the complete physical, mental, and social well-being. But these days, we are a little, not much thinking about the psychological and other aspects, just because the situation demands the physical health and reduce the death rate of persons who are affected with COVID-19. So wellness means it is the complete harmony of physical, mental, spiritual, emotional, social, and environmental aspects. Now coming to the rare situation that we are going through is in January 2020, the WHO declared an outbreak of coronavirus in Wuhan, and then soon after that, WHO declared it as a pandemic. And what it done to India, the ground reality which happened in India was the first case reported in Kerala in January 2020. And then a Janata curfew was announced by the Prime Minister from 7 a.m. to 9 p.m. Where people are urged to stay inside their home. And to contain the spread of fatal disease, complete lockdown was announced for 21 days from March 24. So this was the situation which happened just after the cases of COVID-19 was reported and the time of increasing the number of cases. And then the whole life changed for all the world and even for Indians and Keralites. Nothing was like ever before. It was not like before. We need to change all our lifestyle, our thinking, our behavior, everything we were expected to change just because of this pandemic. And what was the effect of pandemic on people? COVID-19 significantly affected people. It affected the physical health, like the biological health, biological effects like sleep, appetite disturbances, etc. happened during the lockdown. The whole rhythm of working has changed. And the socio-cultural issues due to lockdown and all other aspects, and loss of employment and financial stresses happened. Migration issues that we have seen, people are migrating from one place to their native all over India. In all over world, we were seeing that. But in India, it was so severe that people were traveling from one place to other. And migration issues that we have already said. Then religious aspects, People need to change their religious aspects. The religious places were closed for some time. So that also affected the whole population who are believed in God and believed all those aspects. So these things adversely affect the psychological health of the people. People became more angry, anxious and depressed. And some of the reports by WHO showed that there was a huge increase in the what we say that these home-based violence against people, domestic violence, violence against women, violence against children, etc., increased double-folded that. And psychopathological effects were severe depression, anxiety disorders, suicide and homicide, and substance misuse. Let us discuss these points in detail. Stress, anxiety, and depression, as said, when the global focus has mostly been on testing, finding a cure, and preventing transmission, people are going through myriad psychological problems in adjusting to the current lifestyle and fear of the disease. So during lockdown, there was a 20% rise in the patients suffering from mental illness in Kerala. It was a study done by Lolwal in 2020 and published by the Journal of Indian Psychiatric Society. So this was a very serious issue during this COVID-19. As we all know, it is the stress among people has increased. It is the wear and tear on minds and bodies experience as we attempt to cope with our continually changing environment. So COVID-19 has changed our environment and which affected people in a negative way. So these are the main factors which affect stress among people. The financial stresses that increased, daily hassles, environmental stresses, family related stresses. As we all know that people are during the lockdown, people were restricted to home, and the interaction between family members has become very difficult due to several other factors which contribute to the faculty contribute to this problem. So it increased the stress level of persons. And these are the stages during the stress is happened, which we all know. We are familiar with these stages. Alarm reaction will be there. At first, when we decide, when we see that or find that COVID-19 is reported in Kerala, we all became very anxious, and a very panic situation was there in our state. And later on, people became stable, and a stage of transcendence and all came in effect. And then this is what I have explained earlier. Now, let us come to the health professionals that you are all familiar with, and you are all dealing with people, health professionals in India. A lot of work has been done in Kerala, in India, regarding the mental health of persons who are working in the front line of COVID-19 fight. So first studies came from Wuhan itself. There were around 1,250 nurses were interviewed for their psychological health, and they found that a severe depression is noted in many of the healthcare professionals. And that studies has been published in International Journal of Psychiatry and International Journal of Social Psychiatry, etc. And what is the problem that causes for persons who are working in the front line are longer working hours due to the workforce, due to the reduced workforce. Longer working hours for persons who are working in the COVID-19 response cell. Then lack of personal protective equipments. Not much in Kerala. The reported in North India, even there were situations doctors have to go to the court to fight to get their personal protective equipments, and lack of specific drugs and protocols. But in Kerala, before cases reported in Kerala itself, we had a very clear protocol for treating persons with COVID-19. It is from the experience from the past Nipah outbreak. So that was settled for Kerala sake, but in North India, in all over the world, it was a very, it was a havoc all over the world. And mainly the people who are working in frontline COVID-19 fight was keeping away from family, and it again caused a very significant stress among persons. And frontline medical staff had reported high levels of stress that resulted in post-traumatic stress disorder. I hope all are aware of post-traumatic stress disorders. If need some discussions, let us keep it to the discussion session. It was also found that healthcare professionals considered resignation was there from private sector, faced stigmatization, and feared contagion and spread to family and friends. So these all resulting in high levels of stress, depression, and anxiety symptoms among persons who are working in hospitals. And coming to suicide, one of top 3 causes of death among youth worldwide. This was a report by WHO prior to COVID-19 pandemic. Almost 1 million people die from suicide every year worldwide. 20 times more people attempt suicide. So there are 2 types of suicides. One is attempted suicide and committed suicide. And 20 times more people are attempting suicide and than these who are successful in committing their suicide. Global mortality rate due to suicide is 16%, 100 million, 100,000, or 1 death every 40 seconds and 1 attempt every 3 seconds on average. India ranks 43rd in descending order of rates of suicide with a rate of 10.6. 10.6. So it is the available statistics from 2009. It is also from the WHO website. Now, risk factors for suicide among during COVID-19. Or during COVID-19, not just during COVID-19, there are a very high risk for suicide among during physical health concern and loss of employment and financial crisis. These are the points which or the factors which affect suicide, and severe depression, anxiety disorders, bipolar disorders, and substance abuse. But during COVID-19, the during COVID-19, there are some more points to be added to this factors, which are migration, loss of job, then fear of getting the disease, etc. Now, coming to the effect of lockdown on suicide. Lockdown on suicide actually increased the incidence of depression and anxiety. And as we all know, suicide rates are very high among the addicted people, withdrawal symptoms that cause suicides. Among those addicted to alcohol or other substance due to non-availability following lockdown. That type of suicides we all noticed. Now, how to prevent suicide? We need selective evidence-based and universal interventions are required to prevent suicide. So what all we need to do is protecting and promoting the psychological well-being during and after the outbreak. So we are facing a pandemic. So before that, we are providing online counselings. A lot of organizations other than government is providing psychological support for persons who are affected, and for children there must be special care, evidence-based guidance, support, and sign spotting related to psychological well-being. What I'm emphasizing the point evidence-based guidance, just because there are a lot of people who are providing psychological support unprofessionally, and that sometimes it affects negatively to these people who are affected with some psychological issues. So people must who are in the front line should have a minimum of minimum knowledge and academic qualifications or professional qualifications to attend persons who are affected. Just as doctors or nurses who are attending their patients, psychological support professionals also needed such qualifications. And I'm sorry to say that in Kerala or in all over the world, especially in India, there are no such specific what we call that registration or something for mental health professionals other than psychiatrists or clinical psychologists. So that situation should be changed. Otherwise, it will affect adversely. It will adversely affect the whole population. And public involvement activities should be initiated, or projects should be initiated. Content and technical development with interactive peer review. What we need is we need to prepare contents which must be evident. I mean, which also must be evidence-based to support persons who are affected by COVID-19. And proper delivery and evaluation should be done. A proper research should be done. So how to reduce social anxiety or a person's anxiety and stress during COVID-19? The first and foremost thing is to reduce social stigma. The most important thing, many of doctors, maybe nurses are hearing me now. So you all are sometimes face this type of stigma because people who are around us may not ready to interact with you, or they see you as the person who are carrying coronavirus with you, etc. So that type of stigma is there. And what we need to do is provide peer group support and also family support. And psychological first aid are to be given to persons who are affected with COVID-19, and also for persons who are working in frontline healthcare services. And self-care strategies. Rest, proper rest should be ensured. Work breaks. There should be a proper work breaks, but during the increase of the cases, it is sometimes it become a dream for frontline health workers to take breaks in between. And sleep, proper sleep was very, very essential. And shift of work, fatigue, management of fatigue, and healthy lifestyle and behaviors. Now, managing emotions. We need to take care of moral injury that happens to persons with COVID-19. Sometimes the healthcare professionals who are interacting with family members, if the one of the family member is affected or something happened to them, it will become a very difficult situation for the healthcare workers. So that type of problems can affect their psychological health. Then coping strategies to be improved. Guilt, grief, fear, anxiety, depression, etc. should be taken care of properly. Preventing burnout and psychological trauma. This is another important factor. We need to find time to vent out our feelings. So such type of situations should be encouraged. To sum up, depression, anxiety, and stress among Indian population during the lockdown are prevalent as per several research findings. Along with other measures to contain the spread of COVID-19, mental health of citizens need the urgent attention of Indian government and mental health experts. So these are the reference which I have done for this particular presentation. Mainly, I have gone through the World Health report, mental health by the World Health Organization, and other studies are also there. You can find a lot more studies which are published recently in May, June, July, and July. There are a lot of studies published on psychological support of persons with disabilities, especially in from India. There are mainly 2 or 3 studies I found. From the Jindal Institute and also from Mumbai Edwin Hospital, King Edward Memorial Hospital, they published a paper in Indian Journal of Psychological Medicines in July, in this month, first itself. International Journal of Social Psychology published a paper from Jindal Global University, and Indian Journal of Psychiatry also published these studies related to depression, anxiety, and stress related to socio-demographic correlates, etc. So we need to think of all these factors while interacting with persons who are affected with COVID-19, and also to the general public. We need to convey the message that you need to get the support from the mental health professionals who are qualified mental health professionals, not just mental health professionals, because we can find like mushrooms everywhere in Kerala. You can find at least one counseling center within 1 kilometer distance. You can find one counseling center. Don't let people go there. People need to identify the professionals who are professionally qualified to support persons with persons who, whatever it is, whatever the psychological need is, people should go to the professionals. Otherwise, it will affect the person negatively. So thank you very much for your patient listening, and thank you for this wonderful time. I thank Dr. Usha ma'am and Dr. Valsala ma'am and Dr. Sulekha for this wonderful opportunity to be a part of this webinar, international webinar. Thank you very much, and most welcome for your queries, if any. So thank you, ma'am. Thank you all. Hello.
Hello. Ma'am.
Yes.
To give a detailed deliberation on physical health, sociocultural and emotional difficulties.
Yeah.
And emotional difficulties and psychopathological difficulties. And you also discussed in detail about the various causes of suicide, global rate, risk factors, and special impact with respect to COVID. Okay, ma'am.
I am seeing some, ma'am, I didn't get you because I'm not, it was not clear for you from your side. So I'm seeing one or two questions. How many people committed suicide secondary to COVID? Actually, there are a lot of studies done, as I have mentioned, but one of the study which is published in March, they found around 49 relevant news reports has been analyzed, and they published a report, but total number of suicide is not available right now. But in Kerala, there was a study till April, there were around 66 children who are 66 children who committed suicide during this lockdown. So that type of studies are available, but the total number of suicides is not secondary to COVID-19 is not, I didn't find any, but there is a report which analyzed 49 relevant news reports, and they found that there is an increase of COVID-19, and there are specific reasons to commit suicide. It is secondary to stigmatization, then COVID-19, a fear of affecting COVID-19, and some of the persons who had that psychological problem, psychological disease background also. And I think there is no more questions.
Okay, ma'am, no, there is no more questions. So thank you, ma'am, for very enlightening speech on this topic. So please be online. If at the end there will be some queries you can answer. Okay, thank you so much, ma'am.
Thank you. Thank you very much.
Now we will move on to the third topic of today, that will be delivered by Dr. P.T. Babraj. He is the Associate Professor, School of Behavioral Sciences and Honorary Director of Inter-University Center for Disability Studies, and Director DCDC University. Sir deserves special mention because he was discharged from hospital yesterday evening due to some health problems. And on account of his special interest, he is joining us for this talk. Coming to his educational profile, he has MA Sociology, MA Special Education and PhD in Special Education from University of Calicut and MSc Psychology from Bharatiyar University. He is an academician with 29 years of expertise in research, teaching and training in the field of disability and rehabilitation with hands-on experience in guiding PhD and conducting research projects. His areas of expertise are special education, rehabilitation psychology, behavioral medicine, rehabilitation nursing, and inclusive disaster reduction. And among his achievements and awards, Bahujana Sahitya Academy Award, Bahujana Writers Second National Conference in the year 2019, Dr. Radhakrishnan Best Teacher National Award 2019. He is also the winner of Ambedkar National Award in the year 2010. The other positions he is holding are Expert Member State Advisory Board on Disabilities, Government of Kerala, and Chairman of Examinations, B.Ed Special Education, University of Calicut, and Chairman of BSc Psychology, University of Kerala. He has undertaken a project, statewide training program on strengthening emergency response capabilities of the differently abled people in Kerala, funded by Kerala State Disaster Management Authority. He will be speaking on key challenges faced by persons with disability during COVID-19. The platform is open to you, sir.
Good morning. I'm happy to be with you. The international webinar conducted by College, Kottayam. And I am proud of the organization, especially Dr. Usha. And other faculties. The key challenges faced by patients with a disability during COVID-19, which given me. And let us see, with the 205 cases, capital still in tight spots. Today's Hindu reported 192 contracts the virus through local transmission, 13 large clutches in the district, especially in Trivandrum. This news shows that the hike of COVID-19 people are affected in Kerala, especially in Trivandrum, is high than ever before. And let us see, the pandemic scenario is increasing.
Babura sir, we cannot hear you clearly.
Yeah, you can't hear, sir. I don't know, some problem with the net. Can you hear, sir?
Yeah, now it's a little better.
Yeah, okay. Yeah. Can you see the PPT? Sir, can you see the PPT?
Yes.
Yes, okay. As said, with the 205 cases, capital still in tight spots. The situation, especially in the capital of Kerala. So in the view of this particular scenario, let us see the problems faced by differently able community. But it is very likely to hear that not many persons with disabilities having reported being COVID-19 or positive. I think very few cases have been reported. So let us come to directly the point. Understanding emotional needs of persons with disability during the COVID-19. Persons with disability may express their psychological distress, that is, anxiety, sadness, by acting out in a different way. Each person with disability behave differently. Some may become silent and express anger and hyperactivity. Caregivers need to be patient with persons with disability and understand their emotions. During this COVID breakdown, I got a lot of phone calls from all over Kerala, outside Kerala, especially from Kottayam district itself. And we had announced through MG University website.
Excuse me, sir.
IUCDS. Can you hear? Hello? Can you hear me?
കുറച്ചും കൂടെ സൗണ്ട് കൂട്ടി പറയാവോ?
പറയാം. മൈക്ക്
പലരും പറയുന്നത് കേൾക്കുന്നില്ല.
അതെല്ലേ മൈക്ക് ചൂടെ കൊണ്ട്
മൈക്ക് വേണം കൈ പിടിച്ചോ.
Can you hear loudly? Hello?
Now better. Okay.
Better. Okay. And let us come to the area of different able people's psychological during the COVID-19 era period. The persons with disability we have differently. As I told, some may become silent, while others may feel and express anger and hyperactivity. Especially the caregivers are facing severe problem. During the time of, in the beginning of breakdown of COVID-19, a lot of parents or caregivers used to ring me and complaining that my child is not child. Working day, he used to go to school and spend till 3 o'clock. And after he could follow certain daily activities without any support. But immediately after lockdown, after 1 or 2, 3 days, the child expressed a lot of behavioral problems. And he used to move somewhere else outside the home. In the evening, 6:30, one day in 6:30, he is missed. And his parents and neighbors searched more than 1 hour. Finally, he is waiting somewhere in the outside corridor, half kilometer away from his home. And during this time, he knocked down some doors. And the people came out. Since they know very well this child, they informed, the parents came and bring him to the home. Because the parents complaining that due to the lockdown period, the child is unable to go to school. He couldn't express his emotions, his psychological distress. He can't transfer his certain behavioral issues. During the school time, he was very comfortable with the support of caretakers, school teachers, and some other training activities is being conducted in school. He could divert his attention. He could maintain his emotional balance, etc. Here I am speaking about all emotions are valid emotions. And as caregivers, we need to understand them with empathy. Sometimes engaging in a creative interactive activity can facilitate this process. Help persons with disability find positive ways to express disturbing feelings such as anger, fear, and sadness. This child is also used to express anger. And after sometimes fear. And later he expressed sadness. So the parents were very crisis. How to deal this child properly. And also, let us say, keep and schedules as much as possible. So this is also a problem to the parents. How to prepare a regular or routine program without the proper training aware. The parents were illiterate, sometimes very poor background, socially, economically, or psychologically. They are very poor in condition. So they need special attention, special care, first of all. Then only this child can be managed, because their frustrations, their depression, their stress were very high. And I had to go after 1 week, and I gave certain suggestions. So you do these activities routine and systematically. So there are certain changes be made. At the same time, this fellow suffered with a financial crisis because he used to take medicine. After 1 week, I think so, 2 weeks, they didn't have any money for purchase medicine. And medicine is not available anywhere near a medical college, Kottayam, or a medical college hospital or medical stores. Finally, we collected the medicine with the support of some money. And now it's all fine. If persons with disability are witnessing violence at home, or if they are the target of the violence, it causes trauma and distress and may lead to disruptive behavior. This is actually happening in this particular child. Not this child. Lot of child issues have been reported, especially from Ernakulam, Idukki district. Idukki district is very vulnerable because people with differently abled having raising issues and problems. These people are unable to move to Kottayam. They do not get the proper medicine, or they do not get proper guidance, even phone call. So explain to them that nobody should be stigmatized or signalized for having the disease. Avoid watching, reading, listening, or discussing too much news about the COVID-19 and persuade them to divert their attention to other topics as well. Because as I just read, with the 205 cases, capital still in tight spot. When I utter these sentences, with the 205 cases, tight, so wonderful. So it is unimaginable. So just read out,
Hello.
make a lot. Hello.
Sir,
Can you audible?
audio
Hello.
break ആവുന്നുണ്ട് sir.
Problem.
കേൾക്കാമോ? ആ ഇപ്പം കേൾക്കാം. പക്ഷേ ഓക്കെ,
or and may need specialized help. One death happened in one family, and there was hearing problem. This child is very
Madam, I think his connection is weak. So maybe he can disconnect and connect again. Sir, we are unable to hear you properly.
Hello, sir.
Okay.
Abhilash.
Oh.
Sir, audio വളരെ weak ആണ്. ഒന്ന് disconnect ചെയ്തിട്ട് can you join again? Hello. Hello, sir.
Able to share the screen. Can you do it?
ഒന്ന് ഡിസ്കണക്ട് ചെയ്തിട്ട് സാർ ഒന്നും കൂടെ റീജോയിൻ ചെയ്യാവോ? പവർ പോയിന്റ് ഞങ്ങൾ ഇവിടുന്ന് ഷെയർ ചെയ്യാം. ഓക്കെ.
ഹലോ
ഹലോ സാർ.
കേൾക്കാമോ? ഹലോ.
ഹലോ. കേൾക്കാം.
Okay. Understanding emotional needs of most vulnerable vulnerable face more challenges and may therefore need more care and attention. As I told, some of the persons do not have strong support system and emotional references. The fear and stress caused by COVID-19 may increase their sense of insecurity and cause even more serious mental health issues if not addressed in a timely manner. Let us think some activities that can help the person with disability deal with the stressful events. Listen, give persons with disability opportunities to talk about children. Right?
Madam, since he is not audible, can you ask the next panelist to speak? When he gets it ready, he can come in and join.
or immediately, then only we can have created a supporting environment. So the
Hello. Hello. Abhinay sir. Hello. Hello. Sir. Hello, sir.
Hello, can you hear me?
Sir, ഒട്ടും കേൾക്കത്തില്ല. Hello. Hello, Baburai sir. Hello. അച്ഛൻ്റെ ഫോണൊന്ന് കൊടുക്കാം. Okay, there is some problem with the net problem of Dr. Baburaj. So please bear with us. So I think it is better to invite the next speaker. Is Mr. Rajesh is online? Hello?
Yes, I am online. Yes.
Can you start the next session? Are you ready?
Yeah.
Oh, okay, we will go on your session. After that, we will continue with Dr. Baburaj's session. Okay. Okay, good morning, Mr. Rajesh. So, Mr. Rajesh Divagaran is currently working as a Senior Risk Management Advisor with United Nations High Commissioner for a COVID-19 Management Project in Bangladesh. And he had his BSc Nursing from our college, that is Government College of Nursing, Kottayam. And he had his Master's in Health Administration from Tata Institute of Social Sciences and MSc in Health Policy, Planning and Financing from London School of Economics. And he also had International Certificate in Risk Management from Institute of Risk Management, London. And he has about 20 years of experience with the WHO as he worked with the Global Fund for 12 years in the portfolio and risk management area. Now it is a proud moment in the life of a teacher seeing their students succeed. So it is with utmost joy that I invite Mr. Rajesh Divagaran for this section. So, Mr. Rajesh, please, over to you.
Yeah. Thank you so much. Can I also share my screen? Can you all see this?
Okay.
Okay. Okay. Thanks so much, and good morning, everybody there. And it's been a great opportunity to be back to the school, and also talking to all of you on a subject that is very contemporary right now. So I want to kind of spend a couple of minutes on introducing the topic, which is a general topic, but I want to link it to the COVID care. And also nursing in particular. So these are the two sort of elements that I want to bring into a general topic, which is the general topic here is risk management in patient care. So I want to briefly talk about the importance of risk management in patient care, particularly in the context of COVID. We all know that the patient safety is a key concern, and then we need to minimize the medical errors. that obviously has a profound impact on the ability of the hospitals or care setting to achieve its mission. Having heard the speakers before, clearly there are a lot of additional risks which are posed by disability, particularly if the person is either infected with the COVID, or if there is a preventive mechanism that is required for COVID prevention. So we just need to ensure that these risks are identified and addressed, as the care goes by. And we all have been hearing about patient care crisis in COVID care management, but especially in the beginning part of the epidemic. So we have to sort of think it through how we can avoid the patient crisis, as these things are becoming normal, if you like, a new normal in our care systems. Clearly, the last points are generally, again, to sort of reinforce the fact that the COVID care management, or patients with the COVID, they can actually have several risks, and then we go to manage them effectively. And then this management plan should be integrated in the clinical and nursing practices, of the professionals. I've been thinking a little bit about how do we structure the overall COVID-19 response with regard to a nursing audience, and I sort of thought that in 3 dimensions. There are risks which are posed by the clinical care aspect of it. Patients can present with comorbidities, and if there are no strategies to address them, then that actually exposes the hospital or the care setting. I mean, typically patients with hypertension, diabetes, or other additional comorbidities. So if the hospitals don't have enough referral systems and so on, then the ability of the hospital to address these additional risks will be always a problem. Then when it comes to the complication management, we know that patients can die from acute respiratory distress syndrome, septic shocks, and so on. So if we don't have enough capacity as an organization or a hospital where you are in to deal with those, they can actually be a risk to the overall care of the patient. Then this morning itself, I think many of the speakers before me talked about the need for special care that is to be provided for patients with a disability, and that need to be also sort of taken into consideration when a clinical care is provided. Now, when it comes to operational aspect, I think one of the key challenges is basically lack of access to people with a disability. So the testing access can be limited, their ability to seek care can be limited. So if you are a hospital in a hospital or a care setting that is going to be addressing the overall needs, we need to ensure that those issues are addressed. A few other things that again came to my mind is really about lack of supplies. Again, I understand this is not a major problem in Kerala at this point of time, PPE in particular, but then we all know that this is a acute short supply in many places in many parts of the world, and that's a key risk to providing quality care, even drugs and others. Referral system, I mean, it's very important that people are referred on time, both into a facility and outside the facility if there is a requirement of additional support required. If they're not working well, that can actually create an additional risk to the patient care. So that's important as well. Biological accident, particularly if there's a facility that that deals with the overall let's say testing, and then if the specimens are not appropriately handled, it can lead to accidents and so on. And then one of the key sort of healthcare group that has high mortality are lab technicians. So this is a key aspect of effective patient care. Even in operational aspect, I think the key challenge is also really related to the infection prevention control. If we don't have enough system, donning and doffing, and then clearly the zones are not marked well, that can again create operational challenges or risks in quality care. Documentation and monitoring is a key sort of risk if the patient's conditions are properly not documented, and that's again can pose risk to your quality care. I also think it's important really to see the human resources, in particular the healthcare workers, as a key sort of bucket. And from that perspective, quality training, particularly related to IPC, infection prevention control, disability management, all that is important. So if the people are not trained enough, I think we will not be able to provide quality care. We also talked a little bit about staff fatigue. This was particularly an issue in the beginning of the epidemic in many parts of the world. People are sort of exposed and for a longer duration of time, and that of course is connected to the suicide aspect of it as well, even within the healthcare workers. So staff fatigue is a particular risk that we need to manage when it comes to the quality care. One of the key challenges, key risks that we have is the staff exposures and cross infections. So how do we ensure that these are addressed? And I'll speak in maybe for a couple of minutes on that particular topic, just to give an example of how management can happen as well. So this is not an exclusive list, an indicative list of risks that can be faced by a facility. A system that provide care for people with the COVID-19. So if you are in the clinical team, either in the nursing capacity or a clinical capacity, you need to be analyzing, you are setting against the risk, and then these risks and maybe additional risk specific to this, and then ensure that there are mitigation actions in place to be able to address them as you develop the implementation. I just want to sort of quickly go through a couple of slides on the general risk management aspect, which is not COVID specific, but I'll link it to the COVID sort of context as well here. So here, you probably can see a picture which is on the risk management process. So if again think of if you are working as a nursing staff in one of those hospitals. You need to establish your context, which means, are you providing primary care, preventive care, diagnostic care, or are you providing complication management? Are you simply providing treatment for COVID-19? So that's sort of the context that we are talking about. So within that context, if you are, let's say, for example, in this case, you are dealing with a clinical setting, which is giving isolation and treatment for COVID-19. Then the list that I provided before, you could think of, the key risks that you have. Not everything will be applicable to you. For example, maybe you have enough staff, but they are not trained. Maybe everybody is there, but the numbers are not good enough. Or maybe you don't have enough PPE. So we need to, as a team, identify what those key risks are, and then look into an analysis, and then ensure that enough plans are there to address them. So, in our world, always in risk management, there is always, a table that you can see on the right-hand side, which is a very common thing. So let's take, for example, the key issue here is the lack of PPEs. If you say that, the likelihood of lack of PPE is very high, meaning that, you don't have a supply coming up for the next 20 days, and then that you will have patients for the next 20 days, and then the likelihood is very high that you will not have PPEs. And then if the PPEs are simply not there, meaning, let's say if there's only one PPE left out, then you can say it's a medium risk. If none of the PPEs are there, it's a very high risk. So you're exposing yourself and the facility to a very high risk, and then that need to be a kind of deemed as a very high risk index, and thereby actions need to be taken. So I just want to sort of bring in the point that such analysis is important. Now, in many of these facilities, we have resource constraints. So we need to look into what are the areas where we can address as a top priority. And that should be, again, positively correlated to the risk analysis or the risk levels. So the higher risk should get the higher attention, if you like. So when it comes to an analysis, again, think of the nursing staff who is in the facility, who is dealing with the COVID-19 patients. So she or he need to be a part of the overall assessment, in terms of what the key risks are, how do we prioritize actions, ensure that there is enough accountability and responsibility in terms of getting those actions implemented, and then ensure that this is a part of the overall care, and then we need to monitor the progress against the plan. Again, as I said, I want to give an example of how it can be implemented by highlighting the example of cross-infection as a risk, which is a very common thing in many of our facilities. Meaning if a healthcare worker is exposed, a doctor or a nurse or any other nursing assistant or any other staff, if they're exposed to COVID-19, how a risk assessment can actually be helpful in mitigating the risk, the impact of that particular exposure. As I said again, if there is an exposure, COVID-19 virus exposure, we need to assess the risk. We need to do an assessment. And then based on the assessment, we need to categorize their healthcare workers into different bucket, maybe high exposure or a low exposure. And then we need to ensure that the management of those exposures take place. So in this case, for example, someone who has exposed to a patient with COVID-19 without any PPE, then the exposure can be considered as major, and then or high risk, and then obviously that person need to be quarantined. They need to be tested. And then psychological support need to be provided. And that's again, as a facility, we need to also ensure that the IPC training is also done to ensure that the other people are not really infected, or they don't have the similar exposure to the person who had it just now, or in the recent past that we're talking about. So in case of lower risk exposure, meaning if there is a chance that the person got exposed, then there is a self-monitoring aspect, hand hygiene and effective PPEs, is to be followed. So the key point here is really to sort of understand the exposures and then ensure that plans are put in place to be able to mitigate them. I want to sort of highlight one example of what we call a risk register. Every facility, including a hospital or a healthcare setting, should have something like this. So if you are providing treatment for and nursing care for people with the COVID-19, we need to make a list of risks that you have. That could be from the list that I initially talked about, the 3 classification, meaning clinical, operational, and the healthcare staff. So you can say, again, I'll just give a simple example here, risk exposure, the simple example that we talked about before, cross-infection of, COVID-19 because of, let's say, lack of PPEs, for example. Then the root cause, there is the inadequate supply of PPEs, then it could be lack of training, then the likelihood and impact, then, what are the actions that we are going to do? Maybe you want to, source PPE from other places. You want to reorient your staff immediately. You want to ensure that there is constant supervision in terms of IPC protocols, and then this need to be monitored. Maybe in this case on a weekly basis, and then ensure that the actions are implemented as per the plan. So this is sort of a management sort of an action that to help you to ensure that your facility is able to deliver on high quality nursing and clinical care when it comes to COVID-19. So that's the last slide. So just wanted to sort of drive down one point that we need to ensure that we are able to adapt to the additional risks which are posed by the COVID-19 in an effective way, and we need to move ourselves into taking a proactive step towards meeting the patient needs. And I want to reiterate the fact that if the patients are with the disabilities, the risks are going to be additional, and then there is an additional exposure that needs to be addressed as well. And similarly, when we are doing that, we also need to ensure that the healthcare workers are protected well, and then they have the sufficient capacity to be able to sort of deliver on the care that is required for the patient in a very informed way. We just spoke a little bit about the need for psychological support for people, the nursing staff and the clinical staff, the doctors and the others who are delivering on the COVID-19 patients, and that is something need to be in place, if you like, if you identify them as a risk. So those are the kind of things that will ensure that the care of patients can be taken care of in a systematic way. I mean, in general, risk management is a discipline. It came from a finance services sector. It's actually such an important sort of area for hospital and healthcare workers, in responding to COVID-19. I'll end the session with just an example, is dealing with the situation. I was dealing with the situation in the last, let's say 24 to 48 hours on evacuating people who are infected with the, with the COVID from one of those, let's say remote places in where I used to work before in Bangladesh. So, I mean, it's not a very simple process, maybe, Kerala, we are so advanced in terms of providing care. It seems relatively easy, but for other parts of the world, where it is a challenge, it becomes a very critical component really to ensure that this is done in a very timely and efficient way. Maybe I'll stop there, and if there are any questions, happy to take it. Otherwise, open to discussion, or over to Suleika Madam and others for taking it forward.
Thank you, sir. Sir has given a detailed description about risk management and COVID-19 patient care. He has addressed the key risk exposures in COVID-19 in 3 dimensions: clinical, operational, and human resources. He has also explained risk management process and how to manage the risk of COVID-19 cross-infection and the need for mitigation plans and monitoring. If the participants have any questions, you can ask now. We have not seen any questions in the chat box. Those who want to ask questions can raise your hand. We will unmute them and they can ask directly questions to any of the panelists. So we'll continue with the discussion till Dr. Baburaj sir rejoins.
Ma'am, can you hear me? Okay, Devya ma'am. Hello.
Hello, sir.
Can you hear me? Okay, proceed.
Sir, let me announce one thing.
Yeah.
You can start. So, dear participants, Dr. Baburaj sir has rejoined. Now we'll continue with his session, and after that, move on to the discussion.
Okay, ma'am. Sorry for the inconvenience during the time. And I was talking about recognizing signs of psychological distress needing specialized help, especially the children with the different disablement, and they are having a lot of problems. And among one, difficulties in sleeping and eating that I discussed, and nightmares, being withdrawn or aggressive, complain of pain, stomach in headache without a physical reason, having fears, being afraid to be left alone, clinging, depending behaviors, new fears manifest, decreased interest in playing and engaging in sometimes being sad, cry, violence, abuse, and exploitation. During this time, COVID-19, a high stress in family due to social isolation, economic hardship, and loss of livelihood, increased spanking or beating or using harsh languages. This is a very high among in North Indian people. Already these people are a socially isolated group and economically very poor. And as we used to speak, differently able people are many from the poor family or weak sections or the marginalized community. Because during the time of identification, early intervention, there was no scope, there is no facilities or no support from health field to support this child at the earlier stage. So we used to speak about early intervention, early identification, early rehabilitation. And I would like to remind you professionals, and at least earlier, so the immediate sign of any disablement or problem, please take the child to the very nearest health center or hospitals or medical professionals and do the need immediately. Then only we can reduce the disablement during the developmental stage. Many people still approach the medical professionals after 5 years or 6 years or after 7 years or 8 years because the lack of education, lack of medical facilities, and poor living habilitation, etc. And let us come to the increased risk of violence and abuse and again exploitation. Schools, institutions, closures and movement restrictions means persons with disability are forced to spend much more time at home with adults and caregivers who are already stressed and worried. That also we discussed. And sexual abuse can happen to any child or the adolescent at any time or place. Be vigilant and aware. A lot of cases have been reported from North Indian side. Differently abled people, women, are being sexually abused, taken to hospitals because they're exploiting their ill health, and these people are vulnerable and more prone to get abused. So persons with a disability in quarantine or isolation may be away from adult supervision, which may also increase protection risks. This child may not be follow the hand washing system by using of proper mask and proper health care system, etc. This is also creating problems. And children with disabilities may have stronger reactions to ongoing pandemic. They might have more intense distress, worry, or anger because they have less control over day-to-day well-being than the normal people. The same is true for children with other physical, emotional, or intellectual limitations. They may need extra words of reassurance, more explanation about the event, and more comfort and other positive reinforcement of messages. Talk to them, ensure their needs are taken care, and they are able to participate in all activities. We can bring these children or persons to the mainstream because of proper care, proper training. During this lockdown time, lot of studies have been done, but it has not been reported. Many children are gone to a serious crisis, especially the teachers in special schools, the caretakers working in and around the areas, and special support from the medical field like your people. And I got some information from Trivandrum. Nurses are being taken care, special care to deal differently abled children or persons who are admitted in hospital scenarios, and speak calmly and firmly to the persons if he misbehaves or undertakes any risky behavior. Sometimes do not there intense behavior. Sometimes unwanted behavior may be aroused from the part. So speak calmly and make a proper environment and create appropriate scenario for making them to the normal situation. Younger persons who are drawing a tantrum more than usual, being deviant or acting out may actually be feeling anxious. Pick a calm, undistracted time and gently ask how they are feeling and make sure to respond to outbursts in a calm, consistent and comforting way. Try to understand the situation and the reason behind a certain negative behavior. And I think, and the information from many parts, many children are being problematic situation due to proper medical care, lack of medicine, absence of taking care, and sometimes the environment also creates some problems. And maintain a regular routine and give them specific responsibilities. Build their relationship with them on mutual trust and respect. Every people, every men and women need mutual trust and respect. He properly provide trust, and respect, where we can maintain health, mental health as well as physical health. If we are concerned that they may be at serious risk, talk to them about the possibility of asking for external support. Teach them about personal safety rules. Their body belongs to them, and any uncomfortable touch or gestures made by anyone which makes them feel unsafe is not acceptable. Teach them. So what is the need of keeping a distance? Same times, unfamiliar persons may not be given opportunity to touch the body of a female, especially a differently able persons. Always trust or believe them if they report sexual abuse to you. In case of sexual abuse, always report and seek help. If you are facing domestic violence, seek help. Call women's helpline. Right now, in Kerala, lot of helpline, COVID helpline, government special helpline. Our MG University also supporting differently abled people for giving proper time, care, information, knowledge, and all these things support. In my opinion, not many people are being reported with a differently ablement, with the serious issues like we discussed. Anyhow, and I would like to say professionals like nursing professionals like you can contribute a lot to the period because you are still working. And yesterday I go through one newspaper, though nursing students working in hospital settings as your internship, they are still working along with the COVID people or people who are attending hospital care without proper stipend or proper financial support. This is a serious matter to be taken into consideration. Your service is very high because last 3 days I was admitted in medical college hospital due to headache and some other issues, and I could understand the service provided by you people. It is very great. It is appreciable. In my opinion, my PhD scholars, MPhil scholars, and your professors who are assembling there, they are from MG University School of Behavioral Sciences. They have obtained their PhD, MPhil, etc. from our School of Behavioral Sciences. We are proud of saying about your services because I need not say more about the services that you have to be rendered to the particular community. The courses have been completed by you, sometimes with rehabilitation. Your course is also rehabilitation nursing, your PhD in rehabilitation medicine, and your services is also in rehabilitation area. So it is very supportive, your help, your commitments during this particular period. And I wish all nursing professionals, professors who are engaged, you used to be called Malayalam Malaga. Yes, Malayalam Malaga, because you are really Malagas. So your service activities, especially supporting this community, people, differently able persons, our families, in the level of our higher educational scenario. So I expect all engaged in this research and educational scenario have to extend your services, and you must include this area of study in your curriculum or in syllabus in future also. I appreciate once again.
With ADHD in hospital and home setting.
With our medical college hospital, there is 2 experts, especially working with this area. She is also had her bill in this area from behavioral sciences. Many PhD scholars and doctors from ICH have been completed their MPhil in this particular area. And I used to send this kind of cases to hospitals. Immediately they will attend and they take care of. And these support available in medical field. At the same time, ADHD cases, immediately we can seek support from persons who are on live, and I can give the phone numbers immediately. And some NGOs also providing support to help this kind of people. And I think if my phone number and otherwise our department phone number, my colleague Hena is also in my department, and we can support this kind of fellows who are suffering. And ADHD training immediately is also every child have their own behavioral issues, problems, and if specifically speak, we can have opportunities and facilities to support immediately to this kind of persons. Hello, ma'am, can you hear me? Hello, hello.
Yes, sir, we can hear you.
Yeah. No response from your part. Anything more?
And, we have one more question from Rakesh Nair. She's asking,
Yeah.
is there any special government aid provided for differentially able children during COVID-19?
Yeah, in Tamil Nadu, I think government of India have been sanctioned 1,000 rupees per person in Tamil Nadu. It is being issued in Tamil Nadu. But in Kerala, there is no such financial support is being issued to the differently able community. But due to these issues, COVID-19, any special arrangement is being made immediately. Government of Kerala Health Department are ready to support these people, and some other NGOs also there, and medical health facilities, medicine also provided free. And I got more than 5 complaints since I am a member in the State Advisory Board on Disability, and immediately I contacted the district medical officers, and they issued the medicine and such other support immediately all over Kerala. This is my experience during this period. So, with the support of government of Kerala, what may be the need for this differently able are ready to, even now we are ready to provide by support of NGO or through government services. Right?
So thank you for answering the questions. So we
Yeah.
have no more
Okay.
questions, I think.
Okay.
Okay, okay, thank you, sir. So
Okay.
as you all know, about 15% of the world's population experience some form of disability. Persons with disabilities are more likely to experience adverse socioeconomic outcomes than persons without disabilities, such as less education, poor health outcomes, lower levels of employment, etc. So, sir has discussed in detail about the emotional needs, then avoiding stigmatization, emotional needs of persons with disabilities, and how to handle the stressful events of persons with disabilities. And at this time, I express my sincere gratitude to Dr. Babir Shah for being with us and handle the session, even though his physical illness is, he is not at with his physical.
Thank you.
Okay, sir, thank you so much for your
Thank you.
session.
Thank you for your kind words. Thank you, ma'am.
Thank you, sir.
Okay.
Ma'am, there was a question in the chat box. I hope you missed that question. Actually, that is a very relevant question that recently government has issued that N95 mask is not good. So the question is to Rajesh sir, whether he is here. Could you please respond to that question, sir?
Madam,
Rajesh
we have seen that question. We are planning to ask the question to Rajesh during the discussion time. Rajesh sir, during the discussion time. That is why we did not answer now.
Okay, ma'am. Okay. Thank you. Thank you. Sorry.
Okay, thanks. I mean, many of you have seen there is actually a WHO guideline on rational use of PPEs. And in that guideline, my understanding is that there is no recommendation to reuse the N95 mask. So in the place where I am in at this point of time, we are not reusing N95 masks. But I know this is, again, can be changed based on a local and national guidelines. So I'm not sure of the latest guideline from Government of Kerala, but in the place where I'm in, we are not reusing the N95.
Sir, we have one more question. That is to Mr. Rajesh, sir. Can you share the experiences in Bangladesh in relation to COVID control activities? The question is from Dr. Usha VK, Principal, Government College of Nursing.
Okay, thanks. Thanks again. So I want to briefly maybe just take a couple of minutes really to talk about the difference in the responses between, let's say, Kerala and places like Bangladesh. So from an epidemiological standpoint, I think the disease progression is somewhat similar. I mean, I'm not talking about Kerala, but India. So there are a lot of cases, and then the mortality rates are lower like India. So the district, I'm actually placed in a district which is the home for about 1 million Rohingya refugees, a district called Cox's Bazar. So it's a highly populated, densely populated, area with about, let's say, about 1 million people living in about 15 square kilometers. Now, the key issue in this district is that there are about 3,000 cases in the district as of today, and then there are hardly any ventilators available, at least a month before. So one of our key challenge was really to ensure that the overall health facilities built up from the scratch to be able to deal with the COVID-19 in no time. Because it's like a wildfire, as you can imagine. If one case get infected in a very thickly, densely populated area, it can actually go out of control quite quickly. So one of the key tasks for us as an organization is to set up what we call, rapid isolation centers and treatment centers. So we've been able to set up about 2,000 bedded capacity, as a UN system in a short period of time. That's one thing. Secondly, the other issue is related to providing, support for the staff members. I mean, if you are to sort of, provide care for 2,000 bedded hospital, the staff need to be reassured that they are taken care of if there's an infection come to them. It's very likely that there will be infection come to them. So to the extent that we have converted our offices to ICUs, and thereby giving assurance to the staff that they can be taken care of if they are ill. The other thing that we are also doing at this point of time is actually medevac. You evacuate nationally and internationally to people who are infected if they are facing acute complications. So as I said, one of the examples that was we were able to evacuate a few people from a small place like that to Switzerland in the last few days. So these international evacuations do happen, but that, as you can see, it can be quite complicated. So put it briefly, I think when it comes to the actual need of people on ground, the key challenge is really lack of capacity, lack of beds, lack of ventilators, lack of specialized care. So the idea here is really to supplement what we have with the additional kind of augmented capacity that we can be put in place in short period of time. The overall healthcare systems need to be also supported, meaning including the healthcare staff, and they need to be assured. So we are trying to sort of look into ways of how it can be done effectively by ensuring certain dedicated facilities in places for staff members. And as I said, medevac, which means that would require shifting of people from one place to another place, both nationally and internationally. Again, we can go into the details in a much more sort of detailed way if you want. But if there are any specific area you would like to speak about, I'm happy to kind of speak. Happy to do that as well.
Thank you, Rajesh. Thank you very much.
Any more questions from any of the participants?
Maybe just I want to maybe just if that's okay, I want to just do a couple of points also on the supplies and the challenges. At least in a places like Bangladesh, as I said, there are issues related to timely availability of PPEs, and also challenges related to providing quality care. So, for example, the nursing care that we are talking about, I mean, in my opinion, the quality of nursing care is far inferior to what's available in places like Kerala. So ensuring that those kind of facilities are the nursing care practice itself is sort of ensured is a key priority. And then in terms of supplies, again, key challenge is really to ensure that these supplies do kind of bring down to a facility when it is required, especially during lockdown. And here also we had about 4 months of complete lockdown. At that point of time, it was very difficult for people to get the supplies shifted from the suppliers to the actual point of care, and that aspect had to be given importance. So it's a very sort of I would say an emergency sort of a response when it comes to addressing some of these pandemic, in particularly places which are much more prone to having its own complications and consequences, compared to a system which is well established like Kerala, where I mean we have there is the right required capacity and quality people available. Challenged with these facilities not being available, and that need to be set up in short period of time. It create a crisis, and that's what we are trying to sort of manage in an effective way.
Any other questions from participants? I think we do not have any more questions. We will wind up the session, today's session.
Okay, on behalf of Government College of Nursing Kottayam, we express our sincere gratitude to all the speakers of the day, Mr. Jo, Dr. P.T. Baburaj, Mr. Rajesh Divagaran, and Dr. Hena, and all the participants from different state as well as from abroad. And our sincere gratitude to Principal Government College of Nursing Kottayam. And today we will end our webinar session, and we will join on 6th for the next session. And all of you have to fill the feedback form. The link has been communicated. Okay, that is 15 minutes. Please fill up the feedback form. Thank you all.
Thank you very much, ma'am.